somebody has excess skin on the lower abdomen, they need a tummy tuck. Non-surgical procedures wouldn't do that. A mummy makeover is a surgical makeover of a lady who has been pregnant, and the aim is to restore her body to the pre-pregnant state. Mummy makeover usually involves multiple procedures, and the common procedures are things like abdominoplasty or tummy tuck, breast procedures like a breast lift or breast augmentation, liposuction, etc. However, sometimes the mummy makeover may just involve one particular body part, like somebody who's lost volume in the upper part of your breast and they want the fullness to be restored. That can also serve as a mummy makeover. A suitable candidate or a perfect fit or an ideal candidate for mummy makeover has to be somebody who is in good health, the weight is stable, they understand the pros and cons of the surgery, they have a realistic expectation of what can be achieved, and preferably have completed their family, somebody who's finished childbearing, because future pregnancies can change the way the body looks, and that's important. Well, how long the length of recovery usually depends on the number of procedures this person has. Most patients within 2 weeks begin to potter about to get into light activities. In about 6 weeks' time, most patients are back to work, and they can also go back to the gymnasium, begin to do exercise. But when you go back, you have to take it easy and gradually build up the momentum. That's what it is. But remember, recovery continues for several weeks, several months before the final results begin to show. A myth about mummy makeover is an easy and simple snapback procedure. I think it's important to realize that there's going to be a recovery period that takes several weeks to a few months for most patients. And remember, this is important for those who have a young family. So this is something to bear in mind. Another myth about mummy makeover is there's a one-size-fits-all procedure. No, it isn't. As I say, it's usually a combination of procedures. But what number of procedures or the procedures somebody has differs from patient to patient. This is something we discussed during the consultation, and this, as a qualified surgeon, I'll be able to allay the concerns of the person, discuss all the areas that they want something dealt with, and have a management plan for the patient. Another myth about mummy makeover is that it's one procedure. It can be one procedure for some people if there's only a particular body part that is bothering them. However, typically, a mummy makeover is not the name of a procedure. It's usually the name of a process trying to restore somebody who's been pregnant, trying to restore their body to what it used to be before the pregnancy. With every procedure, there can be complications. There are potential risks and complications. This will be discussed during the consultation. As qualified plastic surgeons, we're trained to take precautions to prevent them in the first place. And if it happens, in the rare instance, that we're able to manage it. However, with any kind of operation, the risks that somebody can have include things like an infection, so we give antibiotics. It can be that blood accumulation underneath the tissues called hematoma. We know how to deal with that. Wound can break down. There could be complications from the anesthesia, complications from a lung operation. These all things will be discussed during the consultation. That's always advise patients, do your own due diligence as well. With procedures, you're going to have incisions on the body. There will be scars. However, most scars fade with time. But I have to say the ultimate appearance of a scar cannot be guaranteed. But as a qualified plastic surgeon, one is trained to put scars in folds or creases so that the body can hide it, and also the scars can be hidden with clothing, normal clothing. Well, your preparation for the surgery will be discussed at the consultation, and I think it's reasonable to state that being healthy is important, that people who are healthy have less likelihood of having problems after any kind of procedure. So adhering to the healthy lifestyle like exercise, good nutrition, avoiding things like smoking, making preparations for somebody to look after you at least in the first 2 weeks after surgery is important, especially if you have a young family. These are the things to have in mind, but these things will be discussed during the consultation. There is no set cost for mummy makeover. It depends on the number of the procedure, or the number of procedures, the complexity of the procedures. It depends on the surgeon, depends on the area of the country where you have this. Even hospital, you'll be surprised. Hospitals have different packages, so they use or different costs for procedures. So those are the things. But these things all be discussed. And remember, as I say, a mommy makeover is a quality of life process. It is not an emergency. So you get the information, digest it. A good number of surgeons will invite you, at least I do it in my practice, invite you for a second chat at no extra cost to you to discuss it, to make sure that you're happy before you go ahead. The results can last a very long time, especially if a healthy lifestyle is maintained. Anecdotally, people maintain a healthy lifestyle continue to enjoy the benefits of it for a long time. The patient is very pleased with the results. Remember, rapid fluctuations in weight will change the way the body appears. Even future pregnancy will change the way it appears. You'll be able to go back to exercise fully, maybe after several weeks. Most patients at 2 weeks begin to some light activities like gentle walks. They can do that. Then after about 6 weeks, most patients are able to go back to the gymnasium or more active exercises. But I always advise you to start slowly and gradually build up momentum. That's always the best way to do it. There are some non-surgical aspects of mommy makeover. I think the aspects that the surgery addresses in the mommy makeover process is different from what non-surgical procedures can do. For example, somebody who has lost a lot of volume, in the anterior aspects of the breast. I know people inject some stuff in the breast, which I don't think is really, in my own opinion. Surgery is the best thing for that, to build back the volume. If somebody has excess skin on the lower abdomen, they need a tummy tuck. Non-surgical procedures wouldn't do that. But there are non-surgical procedures can be done to improve the overall positive effect and try to restore the woman who's had pregnancy, who's been pregnant, to what she used to look like or feel like before pregnancy. So that's where I see non-surgical procedures. That's why they come in the mommy makeover. So it's an adjunct more, not as the primary thing. Unless the person doesn't have the need for the surgical things, then the non-surgical thing becomes a non-surgical makeover for them. Well, how do you choose the right surgeon? I think it's important that as a patient you do your own due diligence. That's important. And choose a qualified plastic surgeon to do the work. I will expect any plastic surgeon to be able to show you before and after pictures of patients that they have done, and also be able to discuss your concerns or any part of your body, be able to allay your fears and concerns, and have a management plan for you. Again, choosing the right surgeon. Rapport is important. Make sure you build a rapport with your surgeon as well. But overall, I think you have to do your due diligence and don't get pressured into it. It's not an emergency. It's a quality of life process, a quality of life procedure. No. I will always advocate general anesthesia. General anesthesia, so as a patient, you go to sleep, you're comfortable. I mean, to have all these procedures under local anesthesia, I think I'll advocate general anesthesia for a mommy makeover. Yes, getting some help within the first 1 or 2 weeks is necessary. So that's essential. If somebody's having all this any kind of major surgery, it's essential.